इस कैमरा
So good evening to one and all. Once again, welcome to our YouTube channel NANDA Nursing Life. So फटाफट लाइव जोड़े ही जाओ. Good evening to all. Right, हमें नर्सिंग फाउंडेशन रा किछि मोस्ट इंपोर्टेंट एमसीक्यू डिस्कशन करथिले राइट. 110 क्वेश्चंस हमें देखि सारी छे. तो फटाफट वीडियो को लाइक कर दियो एवं शेयर कर दियो जेमति समस्त पाखु पहुंची पारिबो. सो पाठ पढ़ा ठीक ठाक चलछि ना समस्तंकर. ठीक स्टार्ट करो. सो आज का फर्स्ट क्वेश्चन 111 which comfort device is used to prevent food drops? Which comfort device is used to prevent food drop? Option is bed cradle, option is footboard, option is sandbag, option is pillow. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया. मोर आवाज सोच ना समस्त को इज इट ऑडिबल टू ऑल? So correct answer is option B, footboard. Right now, footboard, that is the comfort device. Comfort device is used to prevent foot drop. Right. Next question. Next question. Question number 12. All of the following are included in the acquired needs proposed by David McClelland except the option is need for the achievement, option is need for affiliations, option is need for transformation, option is need for power. So which option is the correct answer? So according to David McClelland acquired needs theory, right? According to David McClelland acquired needs theory, acquired needs theory. Three needs are included beta. Three needs are included. Three needs are included. Right? कौन सीटा? Need for achievement. Need for achievement. How कौन अच्छी? Need for affiliation. Need for affiliation. Need for affiliation. Right? And now कौन अच्छी? need for power, need for power, right? These all are about acquired needs theory of David McLeod, right? So need for achievement, it includes in acquired needs theory. The need for affiliation, which includes in David McLeod's acquired needs theory, and need for power also includes in David McLeod acquired needs theory. So कोड छाड़ी की except need for transformation. So option C is the correct answer, right? Except पचारची right? कोड छाड़ी की बाकी तक सबू acquired needs theory that is proposed by David McLeod, right? So option C is the correct answer. Next question, question number 113 रही कौन? Identify the wrong statement from the following except. Option रही consent from must be obtained for all invasive procedures. Option B रही consent is a voluntary act by which a person agree to allow someone else to do something. Option C रही the client must be mentally incompetent to give consent. Option D, consent from should be signed only by the client. So which option is the correct answer? Which option is the correct answer? The correct answer is option C. Right? The client must be mentally incompetent to give consent. इटा को छाड़े की बाकी तक all are the correct statement, right? This is the wrong statement. The client कौन देची आंसर क्वेश्चन का उत्तर पढ़ो. Identify the wrong statement from the following. Identify the wrong statement from the following except. So client, wrong statement is the client must be mentally incompetent, right? And incompetent to give consent because a client with mental incompetence cannot give valid consent, right? So option C is the correct answer, beta, right? Option C is the correct answer. Next question number 114. Mental hygiene primarily refers to option A, the treatment of diagnosed mental disorder. Option B, the practice and study of maintaining and promoting mental health. Option C, the cleanliness of mental health facilities. Option D, personal hygiene habits during psychiatric treatment. Mental hygiene primarily refers to the treatment of diagnosed mental disorder, right? Then option B is the practice and study of maintaining and promoting mental health. Option C is the cleanliness of mental health facilities. Option D is personal hygiene habits during psychiatric treatment, right? So option A is the treatment of diagnosed mental disorder. The practice and study of maintaining and promoting mental health. This option is the correct answer, right? Option B is the correct answer. The cleanliness of mental health facility. Personal hygiene habits during psychiatric treatment. This option is also not correct. So option B is the correct answer, right? Next question, question number 115. When taking blood sample from an AIDS patient, which precautions should be taken? To collect blood sample according to guidelines? So which precautions should be taken to collect blood sample according to standard guidelines? Option A, gown, gloves, mask. Option B, hand washing, sterile gloves. Option C, hand washing, gown, mask and goggles. And option D, gloves only. So which option is the correct answer, beta? फटाफट आंसर करो. So correct answer is option C. Very good, Deepak Kumar Behra. Option C is the correct answer. Hand washing, gown, mask and goggles. So option C is the correct answer, right? Next question, question number 116. When dissolving medicines accidentally needle stuck in middle finger, what is the appropriate actions? Option is hand scrub with soap and water for 5 minutes. Option B is hand wash with betadine. Option C is inform to nursing superintendent. Option D is squeeze the punctured finger. So which option is the correct answer? Sarala Panda option A, Jaskatan Chinda option, Mamata Show option is Jasmita Maji option A. The unscripted life option A. Very good beta. Option A is the correct answer, right? कौन सी पेशेंट निडल स्टिक इंजुरी है आम डिजल्व करूँ से समय एक्सीडेंटली निडल स्टक इन मिडल फिंगर अच्छे राइट सो आम एप्रोप्रिएट एक्शन कौन रैंड स्क्रब विथ सोप एंड वाटर फॉर 5 minutes right option E is the correct answer right so in case of needle stick injury आम कौन कर immediate कौन कर हैंड वॉश कर ना affected area को thoroughly soap and water रे कौन कर क्लीन कर राइट हैंड वॉश कर द्वारा आम कौन कर मिनिमाइज द रिस्क ऑफ इन्फेक्शंस राइट देन आम इन्फॉर्म टू नर्सिंग सुपरिटेंडेंट फॉर फर्दर एक्शंस राइट whatever step they only taken okay good evening Anantashuna. Next question number 117. What is the recommended concentration of potassium permanganate used in oral care? Most important MCQ beta. What is the recommended concentration of potassium permanganate used in oral care? Most important MCQ. What is the recommended concentration of potassium permanganate used in oral care? Option is 1:5,000. Option B is 1:6,000. Option C is 1:4,000. Option D is 1:10,000. So which option is the correct answer? फटाफट आंसर कर दिया. आंसर करो फटाफट फटाफट. So correct answer is option A. 1:5,000. This is the recommended concentration of potassium permanganate used in oral care. Right? Most important MCQ. मन रखो. Next question. Question number 118. So among the following, the task that does not require a registered nurse but can be delegated to the home health aide each. Among the following, the task that does not require a registered nurse but can be delegated to the home health aide each. Option A assessing wound healing progress. Option B adjusting oxygen flow. Option C teaching the client about medications. Option D feeding and bathing the client. So which option is the correct answer? Right, option D is the correct answer. Feeding and bathing the client. Right? ये पर registered nurse required दरकार नहीं. We delegate in home health care. घरे जमते समय तार स्वास्थ्य ଯତ୍ନ नहीं पारे हो ना नहीं खाइबा ठीक समय खाइबा दबा ठीक समय गधेबा है ना नहीं दरकार के मेडिकल health professional दरकार. This is a routine care हाँ कि नहीं. So option D is the correct answer. So not required a registered nurse but can be delegated to the home health aide each. Option D is the correct answer, that is feeding and bathing the clients. Right? Option D is the correct answer. Next question, question number 119, which is not a high risk factor that might affect workers in a construction company. Which is not a high risk factor that might affect workers in a construction company. Option A allergic disease, option B is traumatic injury, option C is chest disease, option D is malnutrition. So which option is the correct answer? बट जो मैंने पर्यंत वीडियो को लाइक करना, वीडियो को लाइक कर दे फटाफट, लाइक कर दे फटाफट प्लीज प्लीज प्लीज, इट्स माय हम्बल रिक्वेस्ट टू वन एंड ऑल। जो मैंने फर्स्ट टाइम चैनल को देखो, चैनल को मध्य सब्सक्राइब मध्य कर दियो, जो मैंने पर्यंत वीडियो लाइक करना, वीडियो को लाइक कर दे फटाफट। So which is not a high risk factor that might affect workers in a construction company? Option A allergic disease, option B traumatic injury, option C chest disease, option D malnutrition. So which option is the correct answer? फटाफट आंसर कर दिया। So option D is the correct answer, right? Option D is the correct answer, malnutrition. So while construction workers can experience a variety of health risk, that is malnutrition, and this is not considered a significant risk factor, right? Option D is the correct answer. Next question, question number 120. What does etiology refer to? What does etiology refers to? Option A is the cause of a disease, option B is the prognosis of a disease, option C is the treatment of disease, option D is the study of disease transmission. So which option is the correct answer? फटाफट आंसर कर दो, फटाफट फटाफट आंसर कर लो। Very good. Option A is the correct answer. The cause of a disease. The cause of a disease is etiology. Etiology refers to the cause of a disease. Cause of a disease. Option A is the correct answer. Very good. Next question, question number 121. What is the main purpose of using a standard formula diagnostic statement in nursing diagnosis? What is the main purpose of using a standard formula diagnostic statement in nursing diagnosis? Option A to evaluate and treat client condition. Option B to identify the nurse's problems. Option C to distinguish nurse's role from that of physicians. Option D to prescribe medication based on symptoms. So which option is the correct answer? जो मैंने फटाफट वीडियो को लाइक करने पर्यंत फटाफट वीडियो को लाइक कर दियो एवं शेयर मध्य कर दियो एवं जदि फर्स्ट टाइम चैनल को देखुछ ताले चैनल को सब्सक्राइब मध्य कर दियो। So what is the main purpose of using a standard formal diagnostic statement in nursing diagnosis? So correct answer is option A, to evaluate and treat client condition. To evaluate and treat client condition, that is the main purpose of using standard formal diagnostic statement in nursing diagnosis, right? Option A is the correct answer. Sarla Panda, correct answer, right? Very good. Next question, question number 122. Rajin. While administering medication to prevent error, patient identification is done by. While administering medications to prevent error, patient identification is done by. Option A, patient tells his name, date of birth, check medication chart, and check patient identification band. Option B, patient tells his name, check medication chart, and check patient identification band. Option C, patient tells his name and check patient identification band. Option D, patient tells his name, patient identification band. So which option is the correct answer? मेडिकेशन एरर को प्रिवेंट करने पे कौन कौन करूची? फर्स्ट जो आइडेंटिफिकेशन केमती करूची? हाउ टू आइडेंटिफाई द पेशेंट? फटाफट आंसर कर दो, आंसर कर दो फटाफट फटाफट. How to identify the patients while administering medication and to prevent medications error. तो करेक्टली आम जो ये करवा चेक करवा ताहले ऑप्शन ए इज द करेक्ट आंसर, राइट. Patient identification band is important. Patient tell his name, date of birth, right, and check medication chart or check medication card, right. So option A is the correct answer, right na beta. Next question, question number 123. What sound is heard when percussing a distended bladder? What sound is heard when percussing a distended bladder? Option B dullness, option B rhonchi, option C wheezing, option D none of the above. So which option is the correct answer? So distended bladder रे कौन था बेटा? कंटेंट्स फ्लूइड. डिस्टेंडेड ब्लैडर रे कौन थिबो? कंटेंट्स फ्लूइड. सो आमे जतले परकशन करूचे ताहले when we are percussion fluid filled area रे है ना, fluid filled area रे जदि हम परकशन करूचे वो टाइप ऑफ साउंड प्रोड्यूस हबो. गुड इवनिंग कावेरी मल्लिक. डल साउंड आसीबो, डलनेस आसीबो, डल साउंड आसीबो हा ना नाही. सो डिस्टेंडेड ब्लैडर रे कंटेंट्स कौन थिबो? फ्लूइड थिबो. सो फ्लूइड फील्ड एरिया रे जदि हम परकशन करूचे ताहले कौन हबो? डल साउंड आसीबो, डल साउंड, right. So correct answer is which option? Option A is the correct answer. No, no, option A is the correct answer. The unscripted live, option A Lipika Kumari, option A Susmita Maji, option A dullness Lipika Kumari. Like very good. Option A is the correct answer. Next question, question number 124. Which of the following are the 4 basic techniques of physical examinations? Option A interview, inspections, percussion, resonance. Option B inspections, palpation, percussion, auscultation. Option C interview, subjective data, objective data, closure. Option D inspections, palpation, percussion, interview. So which option is the correct answer? And which of the following are the 4 basic techniques of physical examination? Most important MCQ, very important MCQ. ये सब क्वेश्चंस आसीबो, simple questions, किंतु हमें भूल भाल आंसर करबा से समय जदि हम भल से पढ़ी नथिबो. So which option is the correct answer? फटाफट आंसर कर दियो, फटाफट आंसर कर दियो. 4 basic techniques, 4 basic techniques, 4 basic techniques. 4 basic techniques of physical examination, of physical examinations. कौन कौन बेटा? फर्स्ट होची inspections, है ना. Then second one is palpation, third one is percussion, and fourth one is auscultation, right now. These 4 are the 4 basic techniques for of physical examinations, right? So which option is the correct answer? Spections, palpation, percussion and auscultation. So option B is the correct answer. Very good. Option B is the correct answer. Pradeep the Gold. Option B. Sarla Panda. Option B. Lipika Kumari Naik. Option B. Ananta Suna. Option B. Sasmita Maji. Option B. Yoshus Nani. Option B. Shuman Mija. Option B. Very good. So option B is the correct answer. Next question, question number 125. A nurse assisted in cerebrospinal tapping. What is the wrong statement related to the sample? A nurse assisted in cerebrospinal tapping. What is the wrong statement related to the sample? Option A, transport the sample immediately to the lab. Option B, refrigerate the sample in case of any delay in transport. Option C, collect cerebrospinal fluid in sterile vials. Option D, the minimum recommended volume of sample is 1 ml. So which option is the correct answer? To फटाफट आंसर कर दियो. Which option is the correct answer? Option. I mean, this is not. What is the wrong statement related to the sample? तो अमुक चार्टा ऑप्शन को हमें बाछिबा. What is the wrong statement related to the sample? Option B, Lipika Kumari Naik, Yashosuna. B, Smita Maji. Option B, Mahendra Mehra. Sir, good evening. Good evening, sir. Ji. Mamata Sahu. Option B, Priyanka Jaina. Option B. Very good. Option B is the correct answer, right? Option B is the correct answer. Refrigerate the sample in case of any delay in transport. This is the correct answer. So हमको रेफ्रिजरेटर स्टोर करिवार नाही CSF sampling को, right? So CSF sampling is not stored in freezer, right? Not stored in freezer, but not stored in freezer. Right? जेमती आमे ब्लड सैंपल पठोचे सेमती सेम वे रे आमे CSF को भी CSF सैंपलिंग को भी आमे पठेबा immediate. Right? Next question, question number 126 रची. When examining a patient with abdominal pain, the nurse in charge should assess option रची quadrant first, option रची the symptomatic quadrant first, option C रची the symptomatic quadrant last, option D रची the symptomatic quadrant either second or third. So फटाफट आंसर कर दो, फटाफट आंसर करो. So correct answer is option C, but the symptomatic quadrant last, right? The symptomatic quadrant last is the correct answer. So when examining a patient with abdominal pain, the nurse in charge should assess the symptomatic quadrant last, right? Next question, question number 127 is 0.45% NaCH. Option is hypotonic solutions. Option B is isotonic solutions, and option C is hypertonic solution. Option D is colloid. So which option is the correct answer? फटाफट आंसर कर दिया. ये सब क्वेश्चंस आसीबो OSSSC नर्सिंग अफसर एग्जाम रे, राइट? सो हम देखिए आइसोटोनिक सॉल्यूशन अंडर कौन कौन आछी आइसोटोनिक सॉल्यूशन यस आइसोटोनिक सॉल्यूशन अंडर कौन कौन आसे बेटा 0.9% सोडियम क्लोराइड और NS नॉर्मल saline राइट देन अब कौन आछी रिंगर लैक्टेट्स अब कौन आछी 5% dextrose right these all are comes under isotonic solutions right then if I am hypotonic solution विषय कथा hypotonic solution रे कौन कौन आछी 0.45% NS a normal saline then 0.33% normal saline और 1/3 NS जोटा कोच है 1/3 normal saline NS right then 0.225% NS और ये को कौन कौन थे 1/4 NS right and 2.5% dextrose. These all are comes under hypotonic solution. Then hypertonic solutions. Hypertonic solutions कौन कौन से 3% sodium chloride right 3% sodium chloride और 3% NS right 3% NS और कौन आसी बेटा 5% NS भी आसी राइट और कौन आसे 10% 10% dextrose 20% dextrose right और कोकुड़ा आसे then 10D 20D ठीक and 50% dextrose right then DNS right these all are comes under hypertonic solutions right तो करेक्ट आंसर कौन बेटा आंसर कर लो कि नहीं so which option is the correct answer so which option is the correct answer so correct answer is option A right option A is the correct answer next question number 128 रची an example of conceptual framework is option रची patient feedback option B nursing process option C रची progress notes option D रची progress patient care so which option is the correct answer so correct answer is option B nursing process right option B is the correct answer next question number 129 is which is the first step in planning health educations which is the first step in planning health educations most important MCQ which is the first step in planning health education option is setting goals option B conducting needs assessment option C identifying a health program option D is prioritizing complications so which option is the correct answer फटाफट आंसर कर दियो correct answer is option B conducting needs assessment right conducting needs assessment very good conducting needs assessments सारला पांडा ऑप्शन बी प्रियंका जेना ऑप्शन बी पूजा नंद ऑप्शन बी लिपिका कुमारी नायक ऑप्शन बी अनीता महांती ऑप्शन बी लिपिका कुमारी नायक सुमन Pradeep the good, option B. Mamata Shah, option B. Pooja Anand, option very good, option B only correct answer beta, option B is the correct answer. ठीक. Next question, question number 130. What is the use of years for the evaluation of various bodies system of child? Option A palpation, option B inspections, option C auscultation, option D integumentary. So which option is the correct answer? What is the use of years for the evaluation of various body system of child? So which option is the correct answer? Very good. Option C is the correct answer. Option C is the correct answer. Right? Here are used in the evaluation of body system through auscultation. Right? Auscultation. So internal sound को हमें केमती सुनुचे ear माध्यम रे ना. Next question, question number 131. Most common venous access site in upper limbs. Most common venous access site in upper limbs. Option A subclavian vein, option B vasculitic vein, option C femoral vein, option D brachial vein. So which option is the correct answer? फटाफट आंसर कर दो. Which option is the correct answer? So correct answer is option B, right? Vasculitic vein. Vasculitic vein. Most common venous access site in upper limbs in vasculitic vein, right? Vasculitic vein. So option B is the correct answer. Next question, question number 132. The assessment method that occurs after the patient has been discharged each. The assessment method that occurs after the patient has been discharged each. Option A concurrent evaluation, option B auditing, option C retrospective evaluation, option D quality assurance. कौन होगा correct answer? The assessment method that occurs after the patient has been discharged is option A concurrent evaluation, option B auditing, option C retrospective evaluation, option D quality assurance. So which option is the correct answer? The correct answer is retrospective evaluations. So retrospective evaluation, that means better what care provide to a patient after they have been discharged, right? That is the retrospective evaluations, right? So option C is the correct answer, right? Next question, question number 133. Skin target test. Skin target test is used to assess most important MCQ, right? Skin target test is used to assess option A hydration status, option B level of pain, option C consciousness, option D infection. So which option is the correct answer? फटाफट आंसर कर दो. निर्भुल भावर है. Skin target test. दीपक माझी, ममता साहू, अस्मिता माझी. Option A. Very good. Option A is the correct answer, right? Option A is the correct answer. So skin target test is used to assess the hydration status. हाँ कि नहीं? So poor skin target हेले कौन होगा बेटा? में डायरिया है तो वोमिटिंग ही थी पर कि फीवर ही थी पर सी पे poor skin target. अब हाँ कि नहीं? जो poor skin target हेले तार फीवर ही थी पर है ना नहीं? Then vomiting ही थी पर and diarrhea, right? ना diarrhea ये थी जो को poor skin target हो, poor skin target, right? So option A is the correct answer. Next question, question number 134. Which technique is used to palpate lymph nodes? Which technique is used to palpate lymph nodes? Option A, compress the nodes between the index fingers of both hands. Option B, move the pads of two fingers in a circular motion. Option C, use the back of the hands and feel the deformities. Option D, move the flat of all four fingers in a vertical motions. So which option is the correct answer? Right, option B is the correct answer. Move the pairs of two fingers in a circular motions. Right, option B is the correct answer. केमती हमें पालपेट करछे lymph nodes को? We locate these glands by moving the fingers of the hand, two fingers in a circular motions. Right, option B is the correct answer. Next question, question number 135. What is called an ongoing assessment process integrated with nursing care? What is called an ongoing assessment process integrated with nursing care? Option A, time lapse assessment. Option B, emergency assessment. Option C, problems focused assessment. Option D, initial assessment. So which option is the correct answer? बेटा फटाफट आंसर कर दे, फटाफट. So correct answer is option C, problem focused assessment. Problem focused assessment. It's an ongoing assessment process integrated with nursing care, right? So option C is the correct answer. Next question, question number 136. What is the most appropriate choice among the following which a nurse pay attention when conducting a general survey an adult client? What is the most appropriate choice among the following to which a nurse pays attention when conducting a general survey an adult client? Option A, appearance and behavior. Option B, measurement of vital signs. Option C, observing specific body system. Option D, collecting detailed health history. So which option is the correct answer? Very good. Option A is the correct answer, appearance and behavior, right? तो आम जो जनरल सर्वे करुचे इनिशियल ओवरऑल असेसमेंट कौन था हमारा क्लाइंट्स अपीयरेंस एंड बिहेवियर, राइट? ऑप्शन ए इज द करेक्ट आंसर, mostly behavior. Very good. Option A is the correct answer, right? Option A only correct answer. Next question, question number 137. Unit planning provides sound basis of. Unit planning provides sound basis of. Option A, implementation. Option B, planning. Option C, replanning. Option D, evaluation. So which option is the correct answer? So correct answer is evaluations, right? Option D is the correct answer. Unit planning provides a sound basis for evaluations. Next question, question number 130. Which of the following is a stage of the nursing process in which the nurse continuously collects data to identify a patient's actual and potential health needs? Which of the following is a stage of the nursing process in which the nurse continuously collects data to identify a patient's actual and potential health needs? Option is planning, option B evaluation, option C implementation, option D assessment. So which option is the correct answer? This type of questions आसिबो एटा ए टाइप रो क्वेश्चन से का आसिबो मोस्ट इंपोर्टेंट एमसीक्यू फटाफट आंसर करो. Very good. Option D is the correct answer. Option D only correct answer, right? Assessment is the first stage of nursing process, right? and we identify the needs of the patient in this assessment stage, right? So option D is the correct answer. Option D is the correct answer. Very good. Option D is the correct answer. Next question, question number 139. When performing an abdominal assessment, in which order are the given steps followed? Option A inspections, auscultation, percussion, palpation. Option B palpation, inspections, percussion, auscultation. Option C percussion, auscultation, inspections, palpation. Option D inspections, percussion, palpation, auscultation. So which option is the correct answer? So को ऑप्शन को हमें करेक्ट मानिबा इंताको हमें आंसर करेवा which ऑप्शन को चूज करेवा हमें को ऑप्शन को चूज करेवा very good Lalita Mahananda Lipika Kumar Naik. Option A is the correct answer. The correct order of for an abdominal assessment, that is option A is the correct answer. Inspections for abdominal assessment, right? Option A is the correct answer. Option A is the correct answer. First inspections, then auscultation, percussion, then palpations, right? This is the correct order for abdominal assessment. Option A is the correct answer, right? Option A is the correct answer, beta. Very good. Option A is the correct answer. Next question, question number 140. Rachita, a patient, it is the most important MCQ. Mane rakhita. Most important MCQ. 5-star questions, right? So 5-star questions. In performing an abdominal assessment, in which order are the given steps followed? Inspection, auscultation, percussion, palpation, right? Next question, question number 140. A patient complaining nausea after had food. Option. Question a patient complaining nausea after had food. This finding is A. Option A is subjective data. Option B is objective data. Option C is personal data. Option D is medical data. So which option is the correct answer? Patient reports nausea after eating. This is a which data? Subjective, objective, personal, or medical data? This finding is a which data? Very good. Option A is the correct answer. Option A is the subjective data, right? Now, patient reports of nausea after eating is a subjective findings or subjective data. हाँ कि नहीं? So option A is the correct answer. Very good. Option A is the correct answer. Next question, question number 141 is the use of the sense of smell to gather data in physical examinations is called most important MCQ. 5-star wala question. The use of sense of smell to gather data in physical examination is called option A auscultation, option B olfactions, option C percussion, option D palpation. So which option is the correct answer? So फटाफट आंसर कर दिया. Which option is the correct answer? बेटा जो मैंने पर्यंत वीडियो को लाइक करना फटाफट वीडियो को लाइक कर दे प्लीज, राइट? जी जन देखुच ना से लाइक दरकार मत जो मैंने फर्स्ट टाइम चैनल को देखुच प्लीज सब्सक्राइब द चैनल and like the video and share the video to your friends. Very good, very good. समस्त आंसर ठीक ठाक अच्छी. So option B is the correct answer. All factions, right? All factions. And this is refers to sense of smell. Okay, sense of smell. And the use of the sense of smell to gather data in physical examination is called olfactions. Next question, question number 142. Most principal method to break infection chain. Most principal method to break infections chain. Most important MCQ 8 abhi. ये टाइप रो ही क्वेश्चंस आसीबो ऑप्शन ए रे हैंड वॉशिंग ऑप्शन बी रे यूज एंटीसेप्टिक सॉल्यूशंस ऑप्शन सी रे वेयरिंग ग्लोव्स ऑप्शन डी रे एवर टचिंग द पेशेंट्स सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा ये टाइप रे का क्वेश्चंस आसीबो बिना कंफ्यूज रे हमको आंसर करबार अछि करेक्ट ऑप्शन चूज करे कि हमको गोल बुलेबार अछि हां कि नहीं ओएमआर सीट रे देतले डार्कन करबा को पड़िबो हां ना नहीं सही ऑप्शन को so which option is the correct answer very good option A only correct answer hand washing most principal method to break infection chain that is hand washing and this is the most effective methods to remove pathogens from hands and preventing them from transfer to other surface or other persons. Option A is the correct answer. Very good. Option A is the correct answer. Next question, question number 143. Which is a site for pulse assessment in an unconscious patient? Which is a site for pulse assessment in an unconscious patient? Option A is mitral pulse. Option B is carotid pulse. Option C is radial pulse. Option D is femoral pulse. So which option is the correct answer, beta? फटाफट आंसर करो फटाफट which is a site for pulse assessment in an unconscious patient 5-star MCQ बेटा most important MCQ ए सब क्वेश्चन से का आसीबो एग्जाम रे 5-star MCQ हमें सब जहाँ भी क्वेश्चन पढ़ुचे ना सब important MCQ ता भितरु ये मु तुम को जणे दोचे मोस्ट इंपोर्टेंट एमसीक्यू सब व्हिच इज ए साइट फॉर पल्स असेसमेंट इन एन अनकॉन्शियस पेशेंट्स राइट करेक्ट आंसर इज कैरोटिड पल्स ऑप्शन बी इज द करेक्ट आंसर एंड दिस इज लोकेटेड इन द नेक so option B is the correct answer carotid pulse right next question number 144 is which among the following technique is used in physical examinations which among the following technique is used in physical examination option is inspections option B is palpation option C is percussion option D is all of these so correct answer is all of these right option D is the correct answer फटाफट आंसर कर दे बेटा Next question number 145 is percussion in chest physiotherapy is not contraindicated in which of the following cases? Percussion in chest physiotherapy is not contraindicated in which of the following cases? Option A is osteoporosis, option B is bones over chest, option C is cystic fibrosis, option D is bleeding disorder. So which option is the correct answer? Very good. Correct answer is cystic fibrosis, right? Option C is the correct answer. Sarla Panda. Option C is the correct answer. Very good. Next question number 146 is which is not an indication of oxygen administrations. Which is not an indication of oxygen administrations. Option A is poisoning. Option B is chest injury. Option C is CPR. Option D is eutosia. So which option is the correct answer, beta? Very good, Lipika Kumar Naik. Eutosia is the correct answer, right? Eutosia is the normal or and uncomplicated childbirth. That is eutosia. हाँ कि नहीं? इथि पाई किछि Oxygen administration darkar nahi. This is not a medical conditions, an indication of oxygen administrations. Option D is the correct answer, right? Next question, question number 147. Which of the following is not the element of an informed consent? Which of the following is not the element of an informed consent? Option A, purpose of study. Option B, offer answer only for selected questions. Option C, subject selection process. Option D, alternative process, alternative procedure, if any, or disclosed. So which option is the correct answer, beta? फटाफट आंसर कर दे, फटाफट. So correct answer is option B, right? Option B is the correct answer. Offer answer only for selected questions. This is not the element of an informed consents. Right? Option B is the correct answer, beta. Next question, question number 148. Bedside assessment of respiration by nursing professional includes all of the following except. Bedside assessment of respiration by nursing professional includes all of the following except. Option A, respiratory rhythm or regularity. Option B, depth of breathing. Option C, assessment of injury to chest. Option D, efforts associated with breathing. So which option is the correct answer? फटाफट आंसर कर दे लो. Bedside assessment of respiration by nursing personnel includes all of the following except. Except C option, assessment of any injury to chest. Right, option C is the correct answer, right? This is the bedside assessment of respiration by nursing personnel, respiratory rhythm and regularity check karology. Then depth of breathing, this is also the assessment of respiration, effort associated with breathing. This is also the assessment of respiration, bedside assessment of respiration, right? So option C is the correct answer. But next question, question number 149 is a COTI bundle is specially designed to prevent. COTI bundle it is specially designed to prevent. Option A, urinary tract infections. Option B, upper respiratory tract infections. Option C, internal infections. Option D, urinary tract infections. So which option is the correct answer? COTI full form कौन है बेटा? Catheter associated urinary tract infections, right? Catheter associated urinary tract infections. COTI. Which option is the correct answer? Option D is the correct answer. Very good. COTI bundle is specially designed to prevent urinary tract infections. Option D is the correct answer. Very good. Next question, question number 150. Which of the following items is used to create a sterile field on the top surface of a table? Option A, surgical wound. Option B, sterile strips. Option C, gowns. Option D, personal protective equipment. Which option is the correct answer? So correct answer is beta sterile drapes. Option B is the correct answer, right? Sterile drapes, that is the item to use create a sterile field on the top surface of the table, right? Option B is the correct answer. Sterile drapes. Next question, question number 151. So the minimum duration required by 5% saline to disinfect the glassware items in the hospital. Most important MCQ, right? The minimum duration is required by 5% solution to disinfect the glassware items in the hospital is DS. Option is 5 minutes, option B is 10 minutes, option C is 9 minutes, option D is 7 minutes. So which option is the correct answer? So minimum duration required by 5% saline to disinfect the glassware in hospital, that is 10 minutes. Option B is the correct answer. 10 minutes, 10 minutes, 10 minutes. Right? Option B is the correct answer. Next question number 152 rachi. Which of the following hand hygiene moments is most frequently missed in clinical settings according to WHO compliance studies? Which of the following hand hygiene moments is most frequently missed in clinical settings according to WHO compliance studies? Option A before touching a patient. Option B after body fluid exposure risk. Option C after touching patient surroundings. Option D after touching a patient. So which option is the correct answer? फटाफट आंसर कर दिया. Which of the following hand hygiene moments is most frequently missed in clinical settings? Frequently missed in clinical settings according to WHO compliance studies. लिपिका कुमारी नायक ऑप्शन सी, सस्मिता माझी ऑप्शन सी, पूजानंद ऑप्शन सी, पूजानंद ऑप्शन सी, सरला पंडा ऑप्शन, Lalita Manand option C. Very good, option C only the correct answer. This is most compliance of WHO studies after touching patient surroundings moment for hand hygiene, right? This is the most frequently missed in clinical settings. And this is the most common area for improvement in infection control practices, right? So option C is the correct answer. Option C is the correct answer. Next question. Question number 153. A nurse working in an ICU is performing surgical hand hygiene. A nurse working in ICU is performing surgical hand hygiene. After hand washing, they must keep their hands. Option A in a comfortable position. Option B below the elbows. Option C below waist level. Option D above elbow level. कौन होगा आंसर? फटाफट आंसर कर दिया. Very good. Option D is the correct answer. Option D is the correct answer. Above elbow level is the correct answer, right? Above elbow level to maintain hand hygiene while performing surgery. Nurse should keep her hand above elbow level. Above elbow level is the correct answer. Option D is the correct answer. Next question. Question number 154. A patient admitted in hospital and suffering from pain, stiffness and fever for 3 days. He is confirmed with HAI, hospital acquired infections, healthcare associated infections. Healthcare associated infections. Healthcare associated infections, right? When should a nurse tell the patient about HAI? Option A on admission. Option B after 1 day. Option C after 2 days. Option D at discharge. और healthcare associated infections भी कौन थे और कौन hospital acquired infections भी कौन थे, right? Hospital acquired infections, right? Hospital acquired infections भी कही पारिबा, healthcare associated infections भी कही पारिबा, okay नहीं? So on admission after 1 day or after 2 days, option D at discharge. So which option is the correct answer? Which option is the correct answer? Yes, nosocomial infections also. Lalita Manand, 48 hour. Option C is the correct answer, right? Option C is the correct answer, 48 hour, right? So option C is the correct answer. Next question. Patient shows sign of hotspot. Patient shows sign of hotspot on his leg cast. Which of the following indicator recognized by nursing officers? Option A is sign of infection. Option B is tightness of cast. Option C is poor percussion from cast. Option D is limited movement. So which option is the correct answer? Sign of hotspot on a cast. So which option is the correct answer? Correct answer is option A, sign of infections, right? Sign of infections. कौन कौन देखा मिले? Foul odor आसी पारे, foul odor, right? Foul odor देखा मिले वो. Pain increase ହେଇଯିବ, ବୁଝିପାରିଲ ନା? Then ଆଉ କଣ ହେଇପାରେ? Fever ବି ଆସିପାରେ, ହଁ ନା ନାଇଁ? This is the indication of potential infections, right? Option A is the correct answer. Next question, question number 156. Which aspect is most important in hospital to prevent crush infection? Which aspect is most important in hospital to prevent cross infections? Option A hand washing, option B PPE kit, option C mask, option D direct contact. So which option is the correct answer? बहुत सारा एग्जाम रे क्वेश्चंस आसी सारितला, राइट? मोस्ट इंपोर्टेंट एमसीक्यू बहुत सारा एग्जाम रे क्वेश्चंस आसी, बहुत सारा, बहुत गुड़ा एग्जाम रे. Which aspect is most important in hospital to prevent cross infections? Most important MCQ. So which option is the correct answer? Correct answer is hand washing only, right? Hand washing is most important aspect in a hospital to prevent cross infections. Option A only correct answer, right? Next question, question number 157. Which of the following method is used to clean the incision site of a surgical drain? Which of the following method is used to clean the incision site of surgical drain? Option A inner to outer following in circular motion. Option B outer to inner following in circular motion. Option C is central to peripheral. Option D is bottom to top. So which option is the correct answer? फटाफट आंसर कर दे. Most important MCQ बेटा. So correct answer is option A. Option A is the correct answer, right? Inner to outer following in circular motion, right? So option A, very good. Kabir Malik. Correct answer is option A. Pooja Nand option A. Sasmita Eka option A. Pradeepta Good option A. Lalita Manand option A. Sarla Panda option A. Lipya Kumari option A. Very good. Next question, question number 158. Right? Which of the following is correct sequence of hand washing? Which of the following is correct sequence of hand washing? Option A, wet the hands with water, put the soap, scrub the hands, rinse with water, dry the hands with tissue paper. Option B, put the soap, wet the hands with water, scrub the hands, rinse the hands with the water and dry the hands with tissue paper. Option C, wet the hands with the water, or wet the hands with the water, put the soap, scrub the hands. Option C, wet the hands with water, put the soap, scrub the hands, rinse the water, dry the hands with dryer. Option D, wet the hands, scrub the hands, put the soap and rinse with water. So which option is the correct answer? So option C is the correct answer. Option C is the correct answer. Wet the hands with water, put the soap, scrub the hands, rinse the water, then dry hands with dryer, right? So option C is the correct answer. This is the correct sequence of hand washing, right? Option C is the correct answer. Sarveshwar, option C. Very good. Option C is the correct answer. Beta. Next question. Question number 159 is which assessment findings would lead the nurse to suspect that a patient's IV line is infiltrated? Infiltrated. So most important MCQ, right? This is the most important MCQ. Which assessment finding would lead the nurse to suspect that a patient's IV line has infiltrated? Option A, and in past hour only 50 ml of fluid has infused. Option B, the incision site is red, hot and swollen. Option C, patient temperature has risen to 38.3 degrees Celsius. Option D, the site is pale, cool, swollen and painful. So which option is the correct answer? Lipika Kumare Naik, option D. Sarveshwar, option D. Kone, option D. Very good. Option D is the correct answer. Right? So suspect an IV infiltration in the site is cool and swollen and painful रहिबा, right? The infiltrated होचे IV line site रे ताहले cool, swollen and painful रहिबा, right? An infiltration कौन बेटा? Leaking into the surrounding tissue. This is the leaking into the surrounding tissue, right? And due to leaking into the surrounding tissue, ये सब symptoms देखा जाओ बेटा. कंपार्टमेंट सिंड्रोम भी होता है बेटा. यही जो लीकिंग फ्लूइड लीकिंग जो लार्ज फ्लू वॉल्यूम फ्लूइड्स लीकिंग जो कौन है बेटा? कंपार्टमेंट सिंड्रोम देखिए को मिलेगा. कंपार्टमेंट सिंड्रोम due to infiltration. Right. Next question. Question number 160. To remove a glove that is contaminated, what should the nurse do first? Option A, grasp the outside of the cuff of palm of the glove and pull it away from the hand without touching the wrist or fingers. Most important MCQ. ಇಲ್ಲ ಈ सब questions भी आसुच. Then option B, put the thumb inside the wrist to slide the glove over the hand with minimal touching of the hand by the other gloved hand. Option C, pull the gloves off the back of the hand until it slides off the entire hand and discard it. Option D, rinse the gloves before removing them to minimize the contamination factor. Answer कर लो फटाफट, ठीक है. To remove a glove that is contaminated, what should the nurse do first? Option A, grasp the outside of the cuff of palm of the glove and pull it away from the hand without touching the wrist or fingers. Option B, put the thumb inside the wrist to slide the glove over the hand with minimal touching of the hand by the other gloved hand. Option C, pull the gloves off the back of the hand until it slides off the entire hand and discard it. Option D, rinse the gloves before removing them to minimize the contamination factor. So which option is the correct answer? Which option is the correct answer? So correct answer is option A is the correct answer. Grab the outside of the cuff of palm of the globe and pull it away from the hand without touching the wrist or finger. So option A is the correct answer, right? Next question, question number 161 achi. What is the best way to prevent hospital acquired infections? What is the best way to prevent hospital acquired infections? Most important MCQ फटाफट आंसर कर दिया जो मैंने जाने छो. ऑप्शन रही यूजिंग प्रोफाइलैक्टिक एंटीबायोटिक. ऑप्शन बी रही मेजरिंग टोटल लीकोसाइट्स काउंट डेली. ऑप्शन सी रही फ्रीक्वेंट हैंड वॉशिंग बाय द केयर गिवर्स विद द सोप एंड वाटर. ऑप्शन डी रही यूजिंग UV rays to sterilize the words. Which option is the correct answer? So correct answer is option C, beta frequent hand washing by the caregivers with soap and water. Option C is the correct answer, right? Option C is the good evening. Next question. Question number 162. What to do after NG tube insertion in a patient with the total gastrectomy? What to do after NG tube insertion in a patient with the total gastrectomy? Option A, immediate suctioning must be performed. Option B, frequent suctioning must be performed. Option C, immediate suctioning should not be performed. Option D, frequent suctioning with NS. So which option is the correct answer? Very good, Kaveri Malik. Option C is the correct answer. Immediate suctioning should not be performed. Right? କାହିଁକି ନା stomach has been removed. Total gastrectomy ହେଇଛି ନା. Total gastrectomy ରେ କ'ଣ ଅଛି? Stomach has been removed and immediate suctioning would be pulling nothing. Only it can irritate the mucosal lining of the esophagus. Right? Irritate the mucosal lining of the esophagus. And newly created gastric pouch को से कौन करेगा? Irritations करेगा. So option C is the correct answer, beta. Option C is the correct answer. Very good. Next question, question number 163. Diseases that are contracted as the result of a medical procedure are known as DSS. Diseases that are contracted as the result of a medical procedure are known as DSS. Option A, iatrogenic disease. Option B, nosocomial disease. Option C, zoonotic disease. Option D, tertiary disease. So which option is the correct answer? So correct answer is option A. Option A is the correct answer. Iatrogenic disease. Right? Option A is the correct answer. Iatrogenic disease. This is a health problem, beta, and is caused unintentionally by medical treatment and medical procedure. कौन हम इन्फेक्शंस पाइबो जेतेले हॉस्पिटल से हॉस्पिटलाइज होला परे कैचिंग एन इन्फेक्शन व्हाइल स्टेइंग इन ए हॉस्पिटल है ना नहीं and developing an allergy reactions from prescribed drug. Okay, no, that these all are about iatrogenic disease, right? So option A is the correct answer, right? Next question, question number 164 is World Hand Hygiene Day is observed every year on Days में World Hand Hygiene Day is observed every year on Days में तो फटाफट आंसर कर दियो 5th May, 15th August, 25th March, option D is 30th July. So which option is the correct answer? So correct answer is option A. Right? World Hand Hygiene Day is observed every year on 5th May. Right? Option A is the correct answer. Next question. Question number 165. Why hand wash is very important step in the procedure for care of wound? Why hand wash is very important steps in the procedure for care of wound? Option A is to avoid any further injury. Option B to cover the wound and quickens healing. Option C is to prevent cross contaminations. Option D is this helps remove extra moisture from the wound. So which option is the correct answer? फटाफट आंसर करो फटाफट So correct answer is option C to prevent cross contaminations. Right? Option C is the correct answer. So washing your hand before caring for a wound is crucial because it removes bacteria and other microorganisms from your skin and preventing them from entering the wounds and causing infections. Right? Option C is the correct answer. Right, beta? जमती क्रॉस कंटामिनेशंस हबने से पे हमें हैंड हाइजीन को important step बोली मानू छे important steps in these procedures, right? Next question, question number 166. In clinical situation, which method for hand hygiene is to be preferred? In clinical situation, which method for hand hygiene is to be preferred? Option A is wash with soap and water. Option B is use alcohol-based hand sanitizer. Option C is clean your hands only when it is visibly solid. Option D is none of these. The most important MCQ beta. Answer करो फटाफट. In clinical situation, which method for hand hygiene is to be preferred? So option B is the correct answer, right? Clinical situations, which method for hand hygiene is to be preferred? Alcohol-based hand sanitizer are preferred for routine hand hygiene in clinical settings. Right now? Option B is the correct answer. When hands are not visibly soiled, that time in that clinical situations, you must use alcohol-based hand sanitizer. Right? Next question, question number 167. For hand hygiene procedure, which parameters are most important? For hand hygiene procedure, which parameters are most important? Option is time duration of hand washing. Option B is technique of hand washing. Option C is both A and B. Option D is none of these. So which option is the correct answer? So correct answer is option C. Both A and B. Next question. Using gloves is absolutely mandatory in which of the following patient care activity? ऑप्शन अछि मेडिकेशन एडमिनिस्ट्रेशन, ऑप्शन बी पेरिनियल केयर आफ्टर चाइल्ड बर्थ, ऑप्शन सी अछि फिजियोथेरापी, ऑप्शन डी अछि रिकॉर्डिंग वाइटल्स. Using gloves is absolutely mandatory in which of the following patient's care activity? फटाफट आंसर करो. Nandini Naik, option B. Nitu, option B. Sarala Panda, option B. Very good. Option B is the correct answer, right? This is mandatory during perineal care after childbirth, right? Using gloves is absolutely mandatory in which of the following patient care activity? That is perineal care after childbirth. This is mandatory for child care after childbirth, and use gloves, right? Next question, question number 169, which is total steps in hand washing following in India. Total steps in hand washing following in India. आंसर करो फटाफट, फटाफट आंसर करो. Total steps in hand washing following in India. Option H is 7, option B is 8, option C is 10, option D is 5. फटाफट आंसर कर दो, फटाफट फटाफट. निवेदिता नायक, शेबन नंदिनी नायक, ए प्रदीप तगुड़ा, ऑप्शन ए नीतू, ऑप्शन ए सरल पंडा, ऑप्शन ए ललिता महानंद 7th. Very good. Option A is the correct answer, right? Option A is the correct answer. 7 steps. We are following total 7 steps in hand washing, right? Rub palm to palm, then rub back to each hand with the palm of the other hand with finger interlace. Rub palm to palm with finger interlace, then rub with back of fingers to opposing palms with fingers interlace. Then fifth step, rub each thumb clasp in opposite hand using rotational movement. Option sixth step, rub tips of fingers in opposite palm in a circular motion. And 7 steps, rub each wrist with the opposite hand, right? These 7 steps we are following in our India for hand washing. Total 7 steps we are following in India, and this is WHO guideline hand hygiene. 7 key steps in proper hand washing with soap and water, right? Palm to palm, back of hand, then between fingers and back of fingers, then base of thumbs and fingernails and wrist. These 7 steps we are following in our India for soap water hand washing. Next question, question number 170. If patient infected with body surface area, then while caring the patient with which PPE should use by the healthcare personnel? Option A is gloves, mask, gown and eye goggles. Option B is gloves and gown. Option C is gloves, mask and goggles. Option D is gloves and mask. So which option is the correct answer? If a patient infected with body surface area, then while caring the patient which PPE should use by the healthcare personnel? Gloves, mask, gown, eye goggles, gloves and gown, gloves, mask, goggles, gloves and mask. So which option is the correct answer, beta? फटाफट आंसर कर दो. तो करेक्ट आंसर is option A, right? Gloves, mask, gown and eye goggles. When caring for a patient with body surface infection, healthcare personnel should use gloves, mask, gown, eye goggles. to minimize the risk of cross contaminations, right? To minimize the cross contaminations. Right. Next question देखिए question number 171 is sequence of doffing सब चली थिला ना COVID-19 टाइम रे COVID-19 टाइम रे डोनिंग चली थिला एंड डोफिंग चली थिला डोनिंग एंड डोफिंग है ना नहीं so sequence of doffing option नीचे hand hygiene mask gown and eye goggles option नीचे hand hygiene gloves eye goggles gown and mask option C नीचे hand hygiene gown mask and eye goggles option नीचे gown mask goggles and hand hygiene. So which option is the correct answer? So correct answer is option B. Right, correct answer is option B. Hand hygiene, gloves, eye goggles, gown, then mask. Right, option B is the correct answer. This is the correct sequence of doffing. Correct sequence of doffing. Hand hygiene, gloves, eye goggles, gown, and mask. Hand hygiene is 70% alcohol. Then gloves को फोपाड़ेगा हाँ ना Doffing means remove all the PPE equipments, right? Personal protective equipments को हमें कौन करेगा? Remove करेगा हाँ ना नहीं and हमें पिंधी बड़ा को हमें donning कोच हाँ ना नहीं putting on PPE process of putting PPE, that is donning and doffing, remove PPE है ना नहीं so correct answer is option B. Next question number 172 अच्छी while changing the dressing nurse inspect that wound area become redness and swelling and in duration of what is possible complications. Option which inflammation, option which eviscerations, option C which dehiscence, option which infections. So which option is the correct answer beta? Most important MCQ. While changing the dressing, nurse inspect that wound area become redness and swelling and in durations what is possible complications. Option which inflammation, option which eviscerations, option C which dehiscence, option which infections. So which option is the correct answer? फटाफट आंसर कर दिया फटाफट आंसर करो तो करेक्ट आंसर जो है इन्फेक्शंस ऑप्शन D is the correct answer. Dehiscence means separations of wound edges, right? Separations of wound edges. And which is not closed properly, right? If the wound is not properly closed due to excessive tensions and eviscerations कौन बेटा severe complications. This is the severe complication of internal organ. wound opening ହେଇଯିବାଟା right. Next question. According to WHO, duration for hand washing with hand rub or alcohol based sanitizer, most important MCQ. According to WHO, duration for hand washing with hand rub or alcohol based sanitizer, option A 20 to 30 seconds, option B 0 to 20 seconds, option C 40 to 60 seconds, option D 3 to 5 seconds. So which option is the correct answer? फटाफट आंसर करो, फटाफट आंसर कर दियो. So which option is the correct answer? So correct answer is option A, 20 to 30 seconds. According to WHO, the recommended durations for hand washing with the hand rub or alcohol based sanitizer, that is 20 to 30 seconds. So option A is the correct answer, right? Next question. Question number 174 is a doctor order to change the dressing, which is a priority nursing actions. Option A wear the gloves, option B remove the dressing and clean the wound, option C hand washing, option D apply antibiotic on the wound. So which option is the correct answer? So correct answer beta first, foremost and first most important steps in aseptic procedure, hand washing is the most important steps, right? Then we perform wound dressing or change. No, so option C is the correct answer. Next question, question number 175, which best describe the asepsis of any surgical instrument. Option A is sterilizations, option B is mopping, option C is scrubbing, option D is disinfection. So which option is the correct answer? Which option is the correct answer? The correct answer is option A, sterilizations, right? Sterilization is the correct answer. Is describe the asepsis of any surgical instrument. तो हमको कहाँ करेगा पड़ेगा, sterilizations पढ़ेगा पड़ेगा ना, नहीं relations में पढ़ेगा पड़ेगा. So option A is the correct answer. Next question, question number 176 is personal protective equipment PPE used when wound caring to a MRSA patient. MRSA patient कौन है बेटा? MRSA patient methicillin resistant Staphylococcus aureus, Staphylococcus aureus. This is MRSA, right? Personal protective equipment PPE used when wound caring to a MRSA patient. Option is mask, option B is gloves, gown, mask, option C is gloves, gown, option D is gown. So which option is the correct answer? So correct answer is option B, gloves, gown and mask. Option B is the correct answer. Very good. Next question, question number 177. What is the influenza precautions? What is the influenza precautions? Option A is isolate the patient, option B is frequently hand washing, option C is wearing mask, option D is wearing gloves. So which option is the correct answer? Beta, which option is the correct answer? बेटा जमती हमर चलला क्लासेस 6 pm रू 10 pm जे चलिबो सेमती कंटिन्यूअसली चलिबो क्लासेस, राइट? समझते एवरी इवनिंग 6 pm रे जॉइन हे जाउतो, राइट? इवनिंग 6 pm रे समझते जॉइन हे जाउतो हमर कंटिन्यूअसली पुनी चलिबो क्लासेस, राइट? मोर देह खराब हेतला एवं किछि काम पाई मु क्लास करू नथिले 2-3 दिन, राइट? पुनी प्रत्येक संध्या रे हम 6 pm रे क्लासेस आरंभ करबा, राइट? आज जेमती स्टार्ट हला डिले हला 20 मिनिट्स लेट हला, बट आमे जेमती प्रत्येक दिन 6 pm रे हम क्लासेस करछु, सेमती प्रत्येक दिन 6 pm रू 10 pm रे क्लासेस हबो. बी रेडी, बी प्रिपेयर, राइट? So what is the influenza precautions? Isolate the patient, frequently hand washing, wearing a mask, wearing gloves. So which option is the correct answer? So correct answer is isolate the patients. Isolate the patients is a crucial step to prevent the spread of virus to others, especially when patient is symptomatic, right? So option A is the correct answer. Next question, question number 178. According to WHO protocol, time required for hand washing with soap and water. Option A 20 to 30 seconds. Option B 10 to 20 seconds. Option C 40 to 60 seconds. Option D less than 5 seconds. So which option is the correct answer? So correct answer is 40 to 60 seconds. According to WHO protocol, time required for hand washing with soap and water, that is 40 to 60 seconds. Option C is the correct answer. Nandini Naik. Option C is the correct answer. Very good. Option C is the correct answer. Next question, question number 179. Acute illness refers to an illness that option is longer than 6 months and can also affect functioning in any dimensions. Option B is synonymous with disease. Option C has a short duration and is severe. Option D cause and irreversible conditions. So which option is the correct answer? So फटाफट आंसर कर दियो. So correct answer कौन होगा? Correct answer is option C, that it has a short duration and it's severe. So option C is the correct answer. Option C is the acute illness refers to an illness has a short duration and it's severe. Severe. So option C is the correct answer. Next question, question number 180. For infection prevention, what will we do? Option A clean cloth to patient. Option B change bed sheet daily. Option C hand wash before and after patient care. Option D antibiotics. So which option is the correct answer? Beta फटाफट answer कर दो. For infection prevention, what will you do? Most important MCQ. एजेंट नर्सिंग ऑफिसर्स तुमको कौन करको हबो फॉर इन्फेक्शन प्रिवेंशन व्हाट विल यू डू ऑप्शन ए क्लीन क्लॉथ टू पेशेंट ऑप्शन बी रे चेंज बेड शीट डेली ऑप्शन सी हैंड वॉश बिफोर एंड आफ्टर पेशेंट केयर ऑप्शन डी एंटीबायोटिक सो फटाफट आंसर करो फटाफट आंसर कर दो सो करेक्ट आंसर इज ऑप्शन सी इज द करेक्ट आंसर हैंड वॉश बिफोर patient care and after patient care, right? Option C is the correct answer. Next question, question number 181, which is spirit should not be applied at the place where the vaccine has to be injected because most important MCQ, spirit not be applied at the place where the vaccine has to be injected because most important MCQ, right? 5 star दे दिया 5 star MCQ. It may cause harmful reactions. Option B, it may produce necrosis. Option C, it may damage live organisms available in vaccines. Option D, it is practiced without having any specific reason. So which option is the correct answer? फटाफट आंसर कर दो फटाफट आंसर कर दो. So option C is the correct answer. Very good, Pradeep. Option C is the correct answer. It may damage live organisms available in vaccines, right? So spirit or alcohol should not be applied at the place where the vaccine has to be injected because it may damage live organisms available in vaccines. Right? Next question, question number 182. Before taking arterial blood gas ABG sample, before taking arterial blood gas ABG samples, syringe should be washed with which drug? Most important MCQ. ABG sample काढ़िबा पूर्वरु आमे को ड्रग सहित वाश आउट करूचे. ऑप्शन अछि हेपारिन, ऑप्शन बी अछि जाइलोकेन 2%, ऑप्शन सी अछि स्पिरिट, ऑप्शन डी अछि बेटाडिन. सो व्हिच ऑप्शन इज द करेक्ट आंसर? बेटा फटाफट आंसर कर दियो जो मैंने जानिछो जो मैंने एबीजी सैंपल ड्रॉ करिछो. सो फटाफट आंसर कर दियो. द करेक्ट आंसर इज वेरी गुड प्रदीप द गुड. ऑप्शन ए नंदिनी नायक, ऑप्शन ए सरला पंडा, ऑप्शन ए स्मॉल बाइट्स, ऑप्शन ए. सो वेरी गुड. ऑप्शन ए इज द करेक्ट आंसर. हेपारानाइज्ड करा जाए, सिरिंज को हेपारानाइज्ड करा जाए और वाश्ड विथ हेपारिन. small amount of liquid heparin है ना आम कौन करुचे lubricant करुचे inner side the syringes are flossing out करुचे है ना नहीं before collecting the blood samples or ABG samples, right? So option A is the correct answer. Next question, question number 183, which is the nosocomial infections? Which is the nosocomial infection? Option A is infection from an animal sources. Option B is infections from mosquito bites. Option C is infection acquired from home. Option D is infection acquired from the hospital. Most important MCQ is questions आसुची आसीब आसु सब बेले सो व्हिच ऑप्शन इज द करेक्ट आंसर फटाफट आंसर करो बिना भूल करिकी so which option is the correct answer beta which option is the correct answer so correct answer is option D very good option D is the correct answer Pradeep Tagudu Sarla Panda Little Aradhya so correct answer is option D is the correct answer option D is the correct answer very good so infection occurred from the hospital that is the nosocomial infections right এটা ভুল করিবার নাই কেবে भी ভুল করিবা নাই क्वेश्चंस आसिले right hospital acquired infection or healthcare associated infections right healthcare associated infections or hospital acquired infections that is nosocomial infections right nosocomial infection that is health care associated infections or hospital acquired infections right this is all about nosocomial infections question number 184 is the reason for regular practice of hand washing techniques in hospital is for the option which prevention of posture related degenerations option which prevention of cross infections option C which prevention of attitude related sickness option which maintenance of oral hygiene so which option is the correct answer the reason for regular practice of hand washing techniques in hospital is for the prevention of posture related degenerations option which prevention of cross infections option C is prevention of attitude related sickness option which is maintenance of oral hygiene so correct answer is option B very good option B is the correct answer next question question number 185 in which strength Savlon used for disinfectant most important MCQ in which strength Savlon used for disinfectant option A 1 is to 40 option which 1 is to 20 option C 1 is to 30 option which 1 is to 60 so which ratio which correct options so correct option is option A this is the recommended dilution for Savlon as a general disinfectant is typically 1 part of Savlon concentrated to 40 parts of water right 1 part of Savlon and 40 parts of water right so 1 is to 40 that is option A is the correct answer this is the recommended dilution for Savlon right option A is the correct answer next question question number 186 standard precaution required the use of protective eyewear when option A caring for a patient with cough option B when wound is oozing blood option C there is a danger of body fluid splashing option D invasive procedure or performed so which option is the correct answer फटाफट आंसर कर दे बेटा most important MCQ this is also 5-star MCQ so which option is the correct answer so correct answer is beta there is a danger of body fluid splashing फ्लैश आउट है कि आम आखिरे पड़ार चांस अच्छी से आमको कौन कर प्रोटेक्टिव आई वेयर पिंधार अच्छे मीन्स आई गॉगल्स पिंधार अच्छे देयर इज ए डेंजर ऑफ बॉडी फ्लूइड स्प्लैशिंग राइट बॉडी फ्लूइड स्प्लैशिंग्स और स्प्रे हेजिबार चांस अच्छे सिक्रेशंस एक्सक्रेशंस कमिंग इनटू विथ द आई नोज और माउथ ताले आमको कौन कर हमको प्रोटेक्टिव आईवेयर पिंधिबा को पड़िबो ड्यूरिंग सर्जिकल प्रोसीजर लाइक वेन्यू पंक्चर्स है और क्लीनिंग रियूजेबल मेडिकल इक्विपमेंट्स से समय हमको आई प्रोटेक्टिव वेयर पिंधिबा को पड़िबो लगे पड़िबो राइट। नेक्स्ट क्वेश्चन नंबर 187 अछि मेडिकल एसेप्सिस डिफर्स फ्रॉम सर्जिकल एसेप्सिस इन दैट इट इज एम्ड एट ऑप्शन ए किलिंग ऑल माइक्रो ऑर्गेनिजम्स, ऑप्शन बी is sterilizing all equipments, option C is preventing entry of microorganisms into the body, option D is preventing transmission of microorganisms. So which option is the correct answer? को ऑप्शन करेक्ट होगा बेटा? मेडिकल एसेप्सिस मीन्स बेटा क्लीनिंग टेक्निक्स राइट। मेडिकल एसेप्सिस मीन्स हो क्लीनिंग टेक्निक राइट, क्लीन टेक्निक right now. And surgical asepsis means beta sterile technique right. Medical asepsis means clean techniques right, and surgical asepsis means sterile technique. So which option is the correct answer? So correct answer is option D is the correct answer beta, preventing transmission of microorganisms. Medical asepsis differs from surgical asepsis in that it is aimed at preventing transmission of microorganisms. Option D is the correct answer. Next question number 188. The nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precautions. Which personal protective equipment PPE will she or he wear the deliver the meal tray? So option A is special filtration mask and gloves. Option B is only mask is needed. Option C is gown, mask, gloves, so cover. Option D is no PPE required. So which option is the correct answer beta? So correct answer is option B, only mask is needed. Right? The nurse assigned to a patient who has bacterial pneumonia and is under droplet precaution. Which personal protective equipment will she or he wear to deliver the meal tray? हमको meal tray देवार अछि right. So option B is the correct answer. Only mask पिन देले भी चलेबा किछि असुविधा नहीं। हमको खाइबा ट्रे दउछे तो हमको मास्क पिन देले most important to prevent ड्रॉपलेट इन्फेक्शंस है ना नहीं। सो ऑप्शन बी इज द करेक्ट आंसर, टू प्रिवेंट ड्रॉपलेट इन्फेक्शंस में हमको मास्क ओनली नीडेड राइट। दिस इज द मोस्ट इंपॉर्टेंट इक्विपमेंट टू वेयर द टू डिलीवर द मील ट्रे। नेक्स्ट क्वेश्चन नंबर 189 which solution is used for cleaning of blood on floor of operation theater? Which solution is used for cleaning of blood on floor of operation theater? Most important MCQ बेटा ये सब MCQ आसीबो राइट, ये सब MCQ आसीबो। ऑप्शन ए क्लोरीन, ऑप्शन बी इज सोडियम हाइपोक्लोराइड, ऑप्शन सी इज फेनॉल, ऑप्शन डी इज फ्यूमिगेशन। सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? फटाफट आंसर कर दे। सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर करो। क्लोरीन, सोडियम hypochlorite, phenol, fumigations. Which solution is used for cleaning of blood on floor of operation theaters? Small words. Option B. Panda. Option B. Very good. Correct answer is sodium hypochlorite. Right? Sodium hypochlorite solutions हमें यूज करेगा क्लीनिंग पे, क्लीनिंग ऑफ ब्लड ऑन फ्लोर ऑफ ऑपरेशन थिएटर। तो हमको सोडियम हाइपोक्लोराइड सॉल्यूशन को यूज करबो पड़ेगा। नेक्स्ट क्वेश्चन नंबर 190 अछि द प्रायोरिटी व्हेन प्रोवाइडिंग ओरल हाइजीन टू एन अनकॉन्शियस क्लाइंट इज टू प्रिवेंट। ऑप्शन बी एस्पिरेशन, ऑप्शन बी माउथ ऑर्डर, ऑप्शन सी डेंटल कैरीज, ऑप्शन डी ओरल अल्सरेशंस। सो व्हिच ऑप्शन इज द करेक्ट आंसर? फटाफट आंसर करो बेटा फटाफट। द प्रायोरिटी व्हेन प्रोवाइडिंग ओरल हाइजीन, the priority when providing oral hygiene to an unconscious client is to prevent. Option A aspiration, option B is mouth odor, option C is dental caries, option D is oral ulceration. So correct answer is option A, aspirations, right? So one considers patient's main priority during oral hygiene or oral care to prevent aspirations better, right? And due to aspiration कौन है बेटा foreign materials पड़ेगा पूरा lungs को पड़ेगा, right? In aspiration pneumonia है जो patient को, तो correct option कौन होगा? Aspirations, right? Option A is the correct answer. Next question, question number 191 is separation of the infected person from uninfected to prevent infections. Option A is isolation, option B is disinfections, option C is quarantine, option D is sterilization. Most important MCQ. Separation of the infected persons from uninfected to prevent infections, isolation, disinfections, quarantine, sterilization. So which option is the correct answer? बेटा फटाफट आंसर कर दे. Separation of the infected person from uninfected to prevent infections, isolation, disinfections, quarantine, sterilization. So which option is the correct answer? So correct answer is option A. Very good. Kaveri Malik, Sarla Panda, option A. Nandini Naik, Gitanjali Das, option A is the correct answer. Very good. Option A is the correct answer. Isolation. This is the most important options and most correct options. Separation and restricted movement of ill persons who have a contagious disease in order to prevent transmission to others, right? So option A is the correct answer. But next question, question number 192. What is the risk factor for the septic shock? What is the risk factor for the septic shock? Option A deep vein thrombosis, option B extreme ages, option C is cardiac failure, option D is none of these. So which option is the correct answer? What is the risk factor for the septic shock? So septic shock risk factor कौन कौन बेटा हम देखिए risk factor for septic shock कौन कौन children, then extreme age, these all are risk factor. Immunocompromised children, immunocompromised children, these all are the risk factor for septic shocks, right? Causes कारण कौन कौन है थे पर बेटा cause urinary infections जो हम बेटा urinary infections, right? Chest infections जो हम chest infections, septicemia जो हम अब कौन abdominal surgery हेतुले भी हम abdominal surgery हेले भी septic shock हवारे chance अच्छी, right? यार management केमती करिवा हमें management, how to manage septic shock? IV fluid NS माध्यम रे IV fluid NS दो हाँ ना नहीं septic shock. If required oxygen O2 दवा and pH को हमें मॉनिटर करिवा बेटा pH मॉनिटर करिवा यदि लेस देन 7 रहइबो ताहले बाइकार्बोनेट्स दवा पड़ो, राइट? ये सब उनको ये सब माध्यम रे हमको मैनेज करके पड़ो सेप्टिक शॉक को, राइट? सो व्हिच ऑप्शन इज द करेक्ट आंसर? सो करेक्ट आंसर इज बेटा ऑप्शन बी इज द करेक्ट आंसर. सो व्हाट इज द रिस्क फैक्टर फॉर द सेप्टिक शॉक? एक्सट्रीम एजेस, राइट? ऑप्शन बी इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 193. A nurse will keep in respiratory isolation of a patient with bacterial meningitis for how long? Option A is 24 hours, option B is 12 hours, option C is 48 hours, option D is till culture negatives. So which option is the correct answer? Correct answer is better 24 hours. A nurse will keep in respiratory isolation of a patient bacterial meningitis for how long? 24 hours. after initiations of appropriate antibiotics, right? This is the correct answer. Option A is the correct answer beta. Next question, question number 194 is which solution used for cleaning to spillage of blood on the floor? Which solution is used to clean to spillage of blood on the floor? Most important MCQ. Option A is chloride mixed solution. Option B. Very good. Gitanjali Das. Option A is chloride mixed solution code है बेटा, सोडियम हाइपोक्लोराइट. Right, sodium hypochlorite. And chloride mixed solution कौन है बेटा? Bleach. And chloride mixed solution, that is bleach. Called bleach contains chloride compounds beta. Chloride compounds. है ना? So option A is the correct answer. Next question, question number 195 is which of the following is not a method of infections control? Option A is improper disposable of sharp instrument and needles. Option B is practicing barrier nursing techniques. Option C is ensure proper segregation of infectious waste. Option D is avoiding direct contact of spoken skin, avoiding indirect contact of open skin lesions. So which option is the correct answer beta? So फटाफट आंसर कर दें. So correct answer is beta option A, improper disposable of sharp instrument and needles. This is not a method of infections control, right? This is not a method of infection control. Which of the following statement is incorrect regarding needle stick injury? Which of the following statement is incorrect regarding needle stick injury? Which of the following statement is incorrect regarding needle stick injury? Option A, discard needles in puncture proof containers. Option B, maintain an exposure control plan. Option C, maintain a sharp injury log. Option D, recap the needle. So which option is the correct answer? So option D is the correct answer. Recap the needle. Never recap the needle beta. Is the incorrect regarding needle stick injury. Recap the needle. Right. Next question, question number 197. The rationale behind not boiling animal ware for long periods. The rationale behind not boiling animal ware for long period is yes. Option A is safe changes. Option B is color fades. Option C is it becomes so hot to touch. Option D is it gets chipped off. So correct answer is option D, it gets chipped off. Damaged ହେଇଯିବ, right? It can cause damage. Secondly, head needle stick injury. While preparing medicines, preparing the medicine inners by mistakenly needle stick injury for which disease post-exposure prophylaxis measure is not required. Option A hepatitis B, option B is hepatitis C, option C is tetanus, option D is HIV. So which option is the correct answer? Post exposure prophylaxis, PEP. Post exposure prophylaxis, PEP. So post exposure prophylaxis is recommended for blood-borne pathogens like hepatitis B, then hepatitis C and HIV, right? ये सब है blood-borne pathogens ना नहीं ए मानक पाए ही हमको पीईपी नवा पाए बाध्य बट नॉट रिक्वायर्ड इन which disease exposure prophylaxis नबाक पड़ेबानी बट हेपाटाइटिस बी डिजीज थिबा पेशेंट किंबा हेपाटाइटिस सी डिजीज थिबा पेशेंट किंबा एचआईवी थिबा पेशेंट जदि निडल स्टिक इंजुरी हेछि ताहाले हमको ताहाले नबाक पड़ेबा पोस्ट एक्सपोजर प्रोफाइलैक्सिस राइट so option C is the correct answer not required in tetanus right option C is the correct answer next question number 199 अछि all of the following are correct about WHO 5 hand hygiene movement except all of the following are correct about WHO 5 hand hygiene movement except option is after touching the patient option B before touching the patient option C is before touching patient surrounding option D is before do any procedure so which option is the correct answer so 5 hand hygiene movement kana WHO 5 hand hygiene movement kana first is before touching the patients right before touching the patients then before do any procedure right then after a procedure after a procedure after a procedure of exposure to body fluid of exposure to body fluids right now ये हला कितने नंबर 3 नंबर then 4 number after touching the patients after touching the patients and fifth one is after touching a patient surroundings after touching a patient surroundings right after touching a patient surroundings so which option is the correct answer beta so correct answer is option C before touching patient surrounding see this is except before touching patient surrounding all are the correct about 5 hand hygiene movement right kana 5 hand hygiene movement first is before touching the patient second is before do any procedure 2 number 3 number after a procedure of exposure to body fluids then 4 number after touching the patients and 5 number after touching a patient surroundings right these all are about 5 hand hygiene movement of WHO right next question number 200 all of the following are preventable hospital acquired infections except option A ventilator associated pneumonia VAP option B रचे catheter associated urinary tract infections COTI option C रचे cannula associated thrombophlebitis CAT and drug associated toxicity DAT right so which option is the correct answer all of the following are preventable hospital acquired infection except फटाफट आंसर कर दो फटाफट आंसर कर दो राजानी कुमारी शो ऑप्शन डी प्रदीप्त गौड़ ऑप्शन डी वेरी गुड ऑप्शन डी इज द करेक्ट आंसर बेटा राइट ऑप्शन डी इज द करेक्ट आंसर तो बेटा आज क्लास ये आम सेशन टाक एंड करवा राइट कलिठू आम पूरा टाइम लू 6 टाइम रे आम क्लास नेवा टाइम 6 PM to 10 PM जे क्लास करिबा राइट आसंता कली संडे जानिच संडे रो सेशन कौन रहे बेटा आसंता कली संडे तो संडे रो दुईटा सेशन राइट मॉर्निंग सेशन रहइबो 10 AM रू क्लासेस आरंभ, देन इवनिंग सेशन 4 PM रू आम क्लास करवा, राइट 10 AM रे एंड 4 PM रे दीटा सेशन रे ड्रग टॉक्सिसिटी हैला पर एंटीडोट दिया हो बेटा यहाँ तो दी हम कहीं दी हेनी ये क्वेश्चन जहाँ पचारे ऑल ऑफ द फॉलोइंग आर प्रिवेंटेबल हॉस्पिटल एक्वायर्ड इन्फेक्शन एक्सेप्ट ये सब हॉस्पिटल रिलेटेड इन्फेक्शंस ना वेंटिलेटर एसोसिएटेड निमोनिया बेसी दिन यदि वेंटिलेटर पेशेंट रहा ताले वेंटिलेटर एसोसिएटेड निमोनिया से बहुत जल्दी हमें पेशेंट को वेंटिलेटर कौन कराऊँ विनिंग कराऊँ बहुत जल्दी हमें ताको एक्सट्यूबेट करने प्लान करूँ जिते जल्दी एक्सट्यूबेट करेबो सेते भल पेशेंट को धीरे धीरे विनिंग करके एक्सट्यूबेट करा जाए कैथेटर जो बेसी दिन जदि रहिबो कैथेटर एसोसिएटेड यूरिनरी ट्रैक्ट इन्फेक्शन सब है ना कैनुला भी चेंज करवार अच्छे अदरवाइज थ्रोम्बोफ्लेबाइटिस हबार अच्छे चांस अच्छे से डेली चेक करवार अच्छे ठीक अच्छे सेमती करवा आसंता काली नर्सिंग फाउंडेशन तो पढ़े पड़ो नेक्स्ट संडे रू आम कौन करवा पूरा मिक्सचर करके खाया पड़ो सब सब्जेक्ट को कंबाइन सब्जेक्ट रो क्वेश्चन आंसर आम करवा ठीक अच्छे करवा मॉर्निंग टाइम रे 100 MCQ डिस्कशन करवा इवनिंग टाइम रे 100 MCQ डिस्कशन करवा मोस्ट प्रोबेबल MCQ ठीक अच्छे ठीक अच्छे नेक्स्ट संडे रू करवा आसंता काली प्रिपेयर कर सारी हमको बहुत जल्दी सब सब्जेक्ट को कवर अप करवार अच्छे ना ठीक तो थैंक यू सो मच टू वन एंड ऑल जो मैंने आजिकर क्लास रे लाइव जॉइन होता राइट तो क्लास को लाइक कर दियो ये पर्यंत लाइक करना एंड शेयर कर दियो समस्त पाखे जमी पहुँची पार और जो मैंने फर्स्ट टाइम चैनल को देखो चैनल को सब्सक्राइब कर दियो हमारा महामाराथन क्लासेस चली 30 डेज रो ऑलरेडी आम 15 डेज कवर अप कर सारे बहुत गुड़ाए सब्जेक्ट आहरी रही सारे नर्सिंग फाउंडेशन आसंता काली सरीज राइट सरेबा आसंता काली टारगेट रखिकी एंड अदर मेजर सब्जेक्ट अच्छी से सब सब्जेक्ट आम सरेबा और 15 डेज रे बहुत गुड़ा क्वेश्चन हमको देखा पड़ो राइट तो आमको स्पीड अफ हवा पड़ो बेटा ना 10,000 आम टारगेट एचिव हो पार 10,000 MCQ इन 30 डेज रे एचिव कर पारे ना तो थैंक यू सो मच टू वन एंड ऑल एंड गॉड ब्लेस टू ऑल राइट स्टे मोटिवेटेड एंड बेटा पाठ पढ़ा कंटिन्यू चली था राइट बंद करिवार नहीं जब तक तोड़ेंगे नहीं तब तक छोड़ेंगे नहीं राइट सो रही बेटा आजिकर क्लास रे नेक्स्ट क्लास रे पुणी थे देखा आसंता काली सकाल 10 AM रे से पर्यंत टेक केयर एंड बाय बाय ओके एंड ऑल द बेस्ट फॉर योर अपकमिंग OSSC नर्सिंग ऑफिसर एग्जाम्स।